Waves of COVID-19 infections have overwhelmed Japan's medical system. At the height of each outbreak, beds were unavailable in many of the country's intensive care units. Some hospitals were even forced to turn patients away to care facilities in other regions.
Even now, Japan's healthcare system is already in a tight situation where we can't save lives that we should be able to save, like COVID patients. Even general patients like people in traffic accidents and people with heart problems can't be admitted because we have so many COVID patients.
Shinobu Morita is president of the Japan Federation of Medical Workers Unions and a retired nurse. The federation represents around 170,000 doctors and nurses across Japan. The group says they need as many people as they can get to help fight COVID, and the call for volunteer doctors by the Games organizers could do more harm than good when Japan's medical system is already stretched thin.
We're short on doctors and nurses already, and we're in a situation right now where we have to face this infectious disease together. If some fall sick, or if they're otherwise no longer in the field, I think the situation will get even worse.
But the Japan Sport Association says it received some 400 applications for the 200 volunteer slots.
Some who have offered to pitch in are retirees. Others are in private practice or have no connection to treating COVID-19 patients. Others still are seeing less patients because people are staying indoors and putting off that next visit to the doctor.
But for Masahiro Ogino, he felt he had the skills and the experience, and he just wants to help out.
I volunteered because I was interested, simple as that. I figured if the Olympics were coming to Japan and I could use my own knowledge and expertise to help out, then I'd like to give it a try. My curiosity was the biggest thing.
Ogino is a neurosurgeon at a university hospital north of Tokyo and actively works with high school and adult teams in his spare time as a sports doctor. He says that Japan prides itself on making sure it gets the job done even in an emergency, and he wants to make sure hurt athletes can get the care they need in those critical first few minutes. But he's worried that he may endanger patients at his hospital.
The measures the Olympics are taking for COVID-19 are full of holes, so I do all of this preparation and wanting to help out, but the place I'm going could end up being a focal point of the pandemic. I've asked myself if it's really okay for me to be going out there. It made me really ambivalent about the situation.
The Olympic and Paralympic committees have gone to great lengths to reassure the Japanese public that the Games will be as safe as they can be.
In the weeks before and during Tokyo 2020, Game stakeholders will be amongst the most tested individuals on Earth, as we take all measures possible to mitigate the risk of COVID-19 transmission. Safety at all times is our top priority for Game stakeholders, and importantly, the people of Tokyo and the people of Japan.
But as a fifth wave of infections rises, the Japanese public is on edge. The surge in cases of the highly contagious Delta and Delta Plus variants around the world has added to fears that the Olympics could become a super spreader event that will test Japan's medical system again. John Matthews, CGTN, Tokyo.